Welcome to MedXpert. In this video, we'll dive into everything you need to know about cataracts, starting from their pathophysiology to their causes, clinical presentation, types, and treatment. By the end of this video, you'll have a complete understanding of cataracts and how they are managed. The word cataract comes from the Latin word cataracta, which means waterfall. Cataract is the clouding of the eye's lens or capsule, leading to progressive vision loss. This condition develops gradually and can significantly impact daily activities if left untreated. Cataracts are the most common cause of blindness, responsible for approximately 50% of cases worldwide. Most common in individuals aged 60 and above, with incidence rising with age. More prevalent in women than men. Higher burden in developing countries due to limited access to surgical treatment. Cataracts form due to progressive lens opacity caused by protein aggregation, oxidative stress, metabolic imbalances, and UV-induced damage. Crystalline proteins misfold and clump together, leading to light scattering and lens opacity, while antioxidants like glutathione and ascorbic acid protect the lens from damage. However, their levels decrease with aging, leading to an accumulation of reactive oxygen species. This oxidative damage results in protein denaturation and lipid peroxidation, ultimately causing lens opacity. In diabetes, excess glucose is converted to sorbitol, causing osmotic stress. This leads to lens fiber swelling and damage, accelerating cataract formation. UV exposure also contributes by generating free radicals that denature proteins and damage DNA. These mechanisms collectively impair lens transparency, leading to vision loss. Cataracts can affect vision in various ways depending on their type and stage. Let's explore some of the most common signs to be aware of. Slow, progressive, painless loss of vision. Cataracts often cause a gradual decline in vision, which may go unnoticed at first. Over time, this can affect the ability to see clearly, especially in low-light conditions. Diplopia or polyopia. Some individuals with cataracts experience double vision in one eye. This condition is called diplopia, which can make things appear blurry or distorted. Glare and halos around lights. Bright lights like street lights or headlights may create halos or intense glare, making it harder to see clearly at night. This is a common issue for people with cataracts. Loss of contrast. People may notice difficulty in reading, sewing, or performing tasks that require concentration, as cataracts reduce the contrast between objects in their background. Changes in color perception. People with cataracts often experience a shift in how they see colors. They might begin to see more browns and ochre and less blue or green. Colored halos. Another sign of cataracts is the appearance of colored halos around lights, which can make night driving particularly challenging. Now let's delve into the underlying causes and risk factors of cataracts. Aging is the most common cause of cataracts, and chances increase with age. Risk factors include UV light exposure, protect eyes with sunglasses, oxidative stress from free radicals, smoking, and a high body mass index. Women, especially postmenopausal, are more likely to develop cataracts, as are those experiencing dehydration or diarrheal crises. While nutritional supplements don't prevent cataracts, maintaining a healthy diet is essential. Managing these risk factors can help delay cataract development. Congenital cataracts are divided into syndromic and non-syndromic types, with 50% being genetic, mostly autosomal dominant. Common types include coralliform cataract, coral-like shape with no profound vision loss; polar cataract, anterior or posterior cataract, limited visual loss, and less than 3 millimeters in diameter; zonular cataract, lamellar, nuclear, or sutural types, with lamellar being the most common in children; total cataract, entire lens opaque, causing decreased visual acuity and nystagmus, seen in Down syndrome and congenital rubella syndrome. Infectious causes of cataracts. The mnemonic torch represents infections passed from mother to child, T for toxoplasmosis, O for other infections like syphilis, tuberculosis, etc. R for rubella, C for cytomegalovirus, H for herpes simplex virus. The most common infectious cause of cataracts is congenital rubella syndrome. Traumatic cataracts are primarily caused by blunt and penetrating trauma. Blunt trauma can result in coup or contra-coup injuries. In coup injury, direct impact causes a vosseous ring, a ring of pigment on the anterior lens capsule, due to the iris striking the lens. While in contra-coup injury, shock waves lead to posterior cortical opacification, resulting in rosette or stellate cataracts. Complicated cataracts are secondary cataracts that develop due to underlying intraocular diseases. Unlike age-related cataracts, these arise as a result of other conditions affecting the eye. Conditions that can contribute include the most common cause uveitis, retinitis pigmentosa, glaucoma, high myopia, Leber's congenital amaurosis, and retinal detachment. Metabolic cataracts develop due to systemic diseases, each with a distinct appearance. True diabetic cataract presents as a snowflake or snowstorm-like opacity. Wilson's disease causes a sunflower cataract. Galactosemia leads to an oil droplet cataract. Myotonic dystrophy forms a Christmas tree cataract. Fabry's disease results in a propeller or spoke-like cataract. Atopic dermatitis associated with shield cataracts. Diabetes alone increases the risk of cataracts by 5 times. Early detection and systemic disease management are crucial to prevent progression. Heat cataracts develop due to prolonged exposure to high temperatures, commonly affecting workers in high heat environments. Common types include true exfoliation cataract, glassblower's cataract, iron worker's cataract. Protective eyewear is essential to prevent heat-induced lens damage. Stay informed, stay protected. Radiation cataracts occur due to ionizing radiation exposure, with X-rays being the most common cause. They typically develop as posterior subcapsular cataracts. The lens is the most sensitive part of the eye to radiation damage. Certain medications can contribute to cataract formation. Systemic steroids are the most common cause, leading to posterior subcapsular cataracts. Chlorpromazine is known to cause stellate cataracts. Other drugs linked to cataract development include chloroquine, amiodarone, busulfan, penicillamine, gold, and ecothiopate. A patient with bronchial asthma presents with a slow, painless loss of vision. The diagnosis is steroid-induced cataract, commonly caused by systemic steroid use. It typically leads to posterior subcapsular cataracts. Cataracts can be classified based on their morphology. The main types include nuclear cataracts, cortical cataracts, and posterior subcapsular cataracts. Nuclear cataracts are characterized by sclerosis and hardening of the lens nucleus, often resulting in yellowing of the lens. They are common in the elderly and present with several clinical features. Patients may experience hemerolopia or difficulty seeing in bright light, and decreased distant vision due to increased refractive index, leading to myopia. Interestingly, some may notice a temporary improvement in near vision, known as second sight, as the cataract increases the lens refractive power, providing short-term relief from presbyopia. Cortical cataracts, also known as cuneiform cataracts, present with distinct clinical features. One notable symptom is nyctalopia, or night blindness, which occurs due to opacification in the outer layer of the lens, making it difficult to see in low light. Cuneiform cataracts are characterized by wedge-shaped opacities that begin at the lens periphery and extend toward the center, often creating a spoke-like appearance. Posterior subcapsular cataracts, also referred to as cupuliform cataracts, present significant clinical challenges. Their location near the nodal point causes maximum visual handicap, leading to considerable glare due to light scattering. The further back the cataract is, the greater the vision loss experienced by the patient. Both near and distant vision are affected, but near vision suffers more, particularly due to miosis or pupil constriction. As cataract develops, it goes through a gradual progression marked by 4 distinct stages. Understanding these stages is crucial for diagnosis and management. The 4 stages of cataract are incipient cataract, immature cataract, mature cataract, and hypermature cataract. Now let's discuss each stage in detail. In the incipient stage, the cataract is still in its earliest phase, characterized by minimal clouding of the lens. At this point, patients may experience mild diplopia, slight blurriness, and difficulty with night vision. However, cataracts usually do not affect daily activities at this stage. During the immature stage of a cataract, partial clouding of the lens occurs, making the iris shadow visible. As the lens becomes more opaque, patients may experience increased glare and worsening difficulty in low-light conditions. These changes can start to affect everyday tasks. In the mature cataract stage, the clouding of the lens becomes severe, leading to extremely blurry vision. At this point, patients may experience significant difficulty with everyday activities. As the cataract progresses, there is a risk of developing glaucoma due to increased pressure inside the eye, which can result in further vision problems. An intumescent cataract refers to the swelling of the lens, which can cause discomfort and complicate cataract surgery if not treated. In the hypermature cataract stage, the lens becomes extremely cloudy and hardened, resulting in severe vision loss. As the cataract progresses, the lens may subluxate, shifting out of its proper position. The lens capsule may wrinkle, and rock-like movement of the lens called phacodenesis can develop, causing eye instability and complicating surgery. Cataracts can be examined from the eyelids and lashes to the anterior one-third of the vitreous. The slit lamp examination helps differentiate cataract types by assessing the color and size of the lens. For posterior examination, 90 diopter or 78 diopter lenses are used to view the posterior two-thirds of the vitreous and retina. Treatment for cataracts begins with glasses, which can help manage vision in the early stages, but are not a permanent solution. Surgery is indicated based on the visual handicap and the impact on daily activities. However, if there are no significant vision problems, surgery may not be necessary. There are several surgical options available. Intracapsular cataract extraction involves removing the entire lens and capsule, leading to aphakia. Extracapsular cataract extraction with intraocular lens removes the lens nucleus while leaving the capsule intact, followed by intraocular lens implantation resulting in pseudophakia. Phacoemulsification uses ultrasound to break up the lens, which is then removed. Small incision cataract surgery involves a larger incision than phacoemulsification, but smaller than intracapsular cataract extraction, followed by lens removal. Micro-incision cataract surgery utilizes even smaller incisions for cataract removal, promoting quicker recovery. Finally, femtosecond laser-assisted cataract surgery employs a laser-assisted technique for precise cataract removal and intraocular lens implantation. For a detailed explanation of these surgical procedures, watch our separate video on cataract surgery. And that wraps up our video on cataract. If you found this informative, make sure to like, share, and subscribe to MedXpert for more medical insights.